Hello friends, I am Dr. Neelam Mahajan. I shall be discussing mucosal drug delivery part 2 under your paper product development 1. In this module we will learn about nasal drug delivery, its advantages and disadvantages, nasal cavity and mechanism of absorption, factors affecting nasal absorption and various nasal drug delivery systems. So let's learn about nasal drug delivery. The nasal cavity is an easily accessible, well-tolerated route. Abundant blood vessels in nasal mucosa contribute to drug absorption at par with intravenous injections in some instances. The nasal drug delivery can be used for localized drug delivery to treat conditions related to nasal cavity like congestion, rhinitis, sinusitis, and related allergic conditions. A diverse range of drugs including corticosteroids, antihistaminics, anticholinergics, and vasoconstrictors can be administered locally. A wide range of pharmaceutical dosage forms including solutions, gels, suspensions, emulsions, liposomes, and microparticles can be used to achieve systemic action with a rapid onset of action when administered via nasal route. For example, intranasal drug delivery of morphine and ketamine to achieve rapid analgesic effects. Friends, after a general introduction of nasal drug delivery, now it is the time to learn about the advantages of nasal drug delivery. Various advantages of nasal drug delivery have been presented for you over the screen. The various advantages of nasal drug delivery include a rapid drug absorption, then it is convenient for long-term therapy compared to parenteral medication, and it is preferred for drugs possessing poor stability in gastrointestinal fluids. Then bioavailability of larger drug molecules can be improved by means of absorption enhancers. Then there is a scope for good bioavailability for smaller drug molecules. It avoids hepatic first pass metabolism, leads to quick onset of action, is useful in patients with nausea, vomiting, and swallowing difficulties, children and old people. It is accessible alternative to parenteral route, and it is promising for systemic delivery of orally inefficient drugs. With proper formulation and dosage form design, the permeability and local environment of mucosa can be controlled and manipulated to accommodate drug permeation. After this explanatory overview of advantages of nasal drug delivery, now it is our turn to learn about the various disadvantages of nasal drug delivery. Again, the disadvantages have been presented for your view over the screen. There are various disadvantages to nasal drug delivery, which include the histological toxicity of absorption enhancers used in nasal drug delivery systems is not yet clearly established. Then it is relatively inconvenient to patients due to possibility of nasal irritation. The nasal cavity provides smaller absorption surface area when compared to gastrointestinal tract, and there is possibility of significant alteration in nasal bioavailability due to pathological conditions like cold or allergies. Let us discuss some of the features of nasal cavity in reference to nasal drug delivery. Nose is the primary entrance to respiratory tract, allowing air to enter into the body for respiration. It is the means of bringing warm humidified air into the lungs, and it is the primary organ for filtering out particles in the inspired air and a first line immunological defense as it brings the inspired air into contact with mucous coated membrane. There is a mucus layer covering the epithelial cells which traps unwanted particles. The mucus secretion consists of 2% mucin, 95% water, 1% salts, 1% proteins like albumin, immunoglobulin, lysozyme, and lactoferrin, and 1% lipids. The pH of the nasal secretions ranges from 5 to 6.5 in adults and from 5 to 6.7 in infants and young children. After drug administration into the nasal cavity, A solute can be deposited at one or more of anatomically distinct regions of nasal cavity, including vestibular, turbinate, and olfactory regions as shown in figure over the screen. So friends, as you can see on the screen in the figure, nasal cavity has got three regions: nasal vestibule, turbinate region, and olfactory region. Nasal vestibule is the interior part of the nose and narrowest part of the nasal cavity. It filters out particles inhaled with air with aerodynamic particle size greater than 10 micrometers. The turbinate region is the large vascular part of the nose composed of mucus secreting ciliated and non-ciliated and basal cells. The ciliated and non-ciliated cells are covered with non-motile microvilli with increased surface area leading to optimal drug absorption. Ciliated cells covered with approximately 100 motile cilia for mucus transport, therefore mucociliary clearance prevails. Coming to olfactory region, this covers about 8% of the total surface area of the nasal epithelium, important for transporting drugs to the brain and cerebrospinal fluid. Friends, now we will discuss mechanism of drug absorption in nasal cavity. The principal step in drug absorption from nasal cavity is the passage through mucus. Fine particles easily pass through mucus layer. However, passage of large particles may find some difficulties. Mucin present in the mucus has the potential to affect the diffusion process by binding with solutes. Structural changes can occur within the mucus layer as a result of environmental or physiological changes. Subsequent to a drug's passage through mucus, there are numerous mechanisms for absorption through mucus. The first mechanism for absorption is paracellular transport. It is slow and passive absorption of peptides and proteins associated with intercellular spaces and tight junctions. Rate of intranasal absorption and molecular weight of water-soluble compounds are inversely related. Drugs with a molecular weight greater than 1000 Daltons show poor bioavailability. The second mechanism is transcellular transport. It involves transport through a lipoidal route and is responsible for the transport of lipophilic drugs. Transcellular transport rate depends on the lipophilicity of drugs. Drugs also cross cell membranes by an active transport route via carrier-mediated means or transport through the opening of tight junctions. The third mechanism is transcytotic transport. In this mechanism, particle is taken into a vesicle and transferred to the cell. Larger peptides and proteins have been shown to be able to pass the nasal membrane using an endocytic transport process, but only in low amounts. Now we shall discuss factors affecting nasal absorption. Nasal drug delivery system is considered as a profitable route for formulation scientists because it has simple and easy formulation strategies, therapeutic efficacy and toxicities of intranasally administered drug products are influenced by number of factors. The factors affecting the absorption of drugs through nasal cavity are: number 1, physicochemical properties. These include acid-base dissociation constant pKa and partition coefficient, molecular weight, particle size, shape, solubility, and dissolution rate of the drugs. In general, for a drug to be absorbed, it must be in solution, and this can be problematic for drugs with low solubility. For instance, polar drugs and some macromolecules are not absorbed in sufficient concentrations because of poor membrane permeability, rapid clearance, and enzymatic degradation. The chemical form of a drug is important in determining absorption. For example, conversion of the drug into a salt or ester form can also alter its absorption. Polymorphism is known to affect dissolution rate and solubility of drugs and thus their absorption through biological membranes. Absorption of drugs with molecular weight up to 300 Dalton is inversely related. Absorption decreases significantly if molecular weight is greater than 1000 Dalton except with the use of absorption enhancers. Shape is also important. Linear molecules have lower absorption than cyclic shaped molecules. For absorption from nasal powders and suspensions, particles deposited in nasal cavity need to be dissolved prior to absorption. If a drug remains as particles or is cleared away, no absorption occurs. Particle sizes greater than 10 micrometers are deposited in the nasal cavity. Formulation factors like type of formulation, excipient, drug concentration, pH, buffer capacity, osmolarity, gelling or viscosity building agents or gel forming carriers, solubilizers, preservatives, antioxidants, humectants, dose volume delivered, and absorption enhancers also have a significant impact. Nasal mucosa is sensitive to local irritation by either drug or excipient. Nasal irritation is minimized when products are delivered with pH in the range of 4.5 to 6.5. Also, volume and concentration are important to consider. The delivery volume is limited by the size of the nasal cavity. An upper limit of 25 mg per dose and a volume of 25 to 200 microliters per nostril have been suggested so as to avoid irritation of nasal mucosa, to allow the drug to be available in unionized form for absorption, to prevent growth of pathogenic bacteria in the nasal passage, to maintain functionality of excipients such as preservatives, and to sustain normal physiological ciliary movement. Lysozyme found in nasal secretions is responsible for destroying certain bacteria at acidic pH. Under alkaline conditions, lysozyme is inactivated and nasal tissue is susceptible to microbial infection. Keeping in mind the physicochemical properties of the drug, the formulation should be kept at a pH of 4.5 to 6.5 so as to keep drugs in the unionized form, facilitating absorption. Nasal formulations are generally administered in small volumes ranging from 25 to 200 microliters. Hence, nasal secretions may alter the pH of the administered dose. This can affect the concentration of unionized drug available for absorption. Therefore, an adequate formulation buffer capacity may be required to maintain the pH in situ. Drug absorption can be affected by the tonicity of the formulation. Shrinkage of epithelial cells have been observed in the presence of hypertonic solutions. Hypertonic saline solutions also inhibit or cease ciliary activity. Low pH has a similar effect as that of a hypertonic solution. Increase in solution viscosity may provide a means of prolonging the therapeutic effect of nasal preparations of low molecular weight drugs. Aqueous solubility of drugs is always a limitation for nasal drug delivery in solution. Conventional solvents or co-solvents like glycols, small quantities of alcohol, medium chain glycerides and labrazole can be used to enhance the solubility of drugs. Other options include the use of surfactants or cyclodextrins that serve as a biocompatible solubilizer and stabilizer in combination with lipophilic absorption enhancers. Most nasal formulations are aqueous based and need preservatives to prevent microbial growth. For example, parabens, benzalkonium chloride, phenylethyl alcohol, EDTA and benzoyl alcohol. Mercury containing preservatives have a fast and irreversible effect on ciliary movement and should not be used in nasal systems. Usually, antioxidants do not affect drug absorption or cause nasal irritation. Commonly used antioxidants are sodium metabisulfite, sodium bisulfite, and tocopherol. Many allergic and chronic diseases are often connected with crust formation and drying of mucous membrane. Therefore, humectants can be added, especially in gel-based nasal products. Humectants avoid nasal irritation and are not likely to affect drug absorption. Common examples include glycerin, sorbitol, and mannitol. Drug concentration, dose, and volume of administration are three interrelated parameters that impact the performance of nasal delivery performance. Nasal absorption of L-tyrosine was shown to increase with drug concentration in nasal perfusion experiments. Many drugs having high water solubility have poor permeability across nasal epithelia and hence insufficient bioavailability. To enhance their permeation and bioavailability, permeation enhancers are frequently employed. In principle, permeation enhancers induce reversible modifications on the structure of epithelial barrier. Although the exact mechanism of drug absorption is not well known, it is widely accepted that these materials, that is, the permeation enhancers, modify the permeability of epithelial cell layer by modifying the phospholipid bilayer. Absorption enhancers may be required when a drug exhibits poor membrane permeability, larger molecular size, lack of lipophilicity, and enzymatic degradation by aminopeptidases. Osmolarity and pH may accelerate the enhancing effect. Absorption enhancers improve absorption through many different mechanisms like increasing membrane fluidity, increasing nasal blood flow, decreasing mucus viscosity, and enzyme inhibition. Physiological and anatomical factors affecting nasal drug delivery include nasal blood flow, enzymatic degradation, mucociliary clearance, and physical condition of the nose. Some conditions like nasal atrophic rhinitis and severe vasomotor rhinitis can reduce the capacity of nasal drug absorption, and drug can be lost by dripping out of the nose or down the back of the throat, thus reducing bioavailability. Deposition of the formulation in the interior portion of the nose provides a longer nasal residence time. The interior portion of the nose is an area of low permeability, while posterior portion of the nose is where the drug permeability is generally higher and provides shorter residence time. Nasal mucosal membrane is very rich in vasculature. The blood flow and therefore the drug absorption will depend upon the vasoconstriction and vasodilatation of blood vessels. Several enzymes that are present in nasal mucosa might affect the stability of drugs. For example, proteins and peptides are subjected to degradation by proteases and aminopeptidase at mucosal membrane. The level of aminopeptidase present is much lower than that in gastrointestinal tract. Peptides may also form complexes with immunoglobulins in the nasal cavity, leading to an increase in the molecular weight and a reduction of permeability. Absorption of drugs is influenced by residence time between the drug and the epithelial tissue. The mucociliary clearance is inversely related to residence time and therefore inversely proportional to absorption of drugs administered. Nasal mucociliary clearance can also reduce contact time and drug absorption by transporting the drug to nasopharynx and then to gastric intestinal tract. Mucociliary clearance can be overcome by incorporating mucoadhesive polymers into formulation, which may increase nasal absorption. The mucus layer can also be a barrier for drug absorption either by limiting drug diffusion or by binding drugs to mucins. Some conditions like common cold and hay fever can also change conditions within the nose either by increasing or decreasing mucociliary clearance or altering the permeability of absorbing mucosa. These limitations must be recognized and addressed when designing formulations to target drug absorption by nasal route. Now we will have a discussion of the various nasal drug delivery systems. First nasal drug delivery system is nasal drops. These are one of the most simple and convenient systems developed for nasal delivery. It has been reported that nasal drops deposit human serum albumin in the nostrils more efficiently than nasal sprays. The main disadvantage of this system is lack of dose precision, and therefore nasal drops may not be suitable for prescription products. Now talking about nasal sprays, both solution and suspension formulations can be formulated into nasal sprays. Due to the availability of meter dose pumps and actuators, a nasal spray can deliver an exact dose. The particle size and morphology of the drug and viscosity of the formulation determine the choice of pump and actuator assembly. The next nasal drug delivery system is nasal gels. Nasal gels are high viscosity thickened solutions or suspensions. The advantages of a nasal gel include the reduction of post-nasal drip due to high viscosity, reduction of taste impact due to reduced swallowing, reduction of anterior leakage of the formulation, reduction of irritation by using soothing emollients or excipients, and target to mucosa for better absorption. The next system is nasal powder. Nasal powders may be developed if solution and suspension dosage forms cannot be developed, for example, due to lack of drug stability. The advantages to nasal powder dosage forms are the absence of preservative and superior stability of the formulation. However, the suitability of the powder formulation is dependent on solubility, particle size, aerodynamic properties, and nasal irritancy of the active drug and excipients. Next nasal drug delivery system is liposomes. Liposomes are phospholipid vesicles composed by lipid bilayers enclosing one or more aqueous compartments wherein drugs and other substances can be included. Liposomal nasal solutions can be formulated as drug alone or in combination with pharmaceutically acceptable excipients. These are administered to the respiratory tract as an aerosol or a solution for a nebulizer, or as a microfine powder for insufflation alone or in combination with an inert carrier like lactose. The particles of the formulation have diameters less than 50 microns. Liposomal drug delivery systems present various advantages like effective encapsulation of small and large molecules with a wide range of hydrophilicity and pKa values. In fact, they have been found to enhance nasal absorption of peptides like insulin and calcitonin by increasing their membrane penetration. This has been attributed to increasing nasal retention of peptides. Nanoparticles. Nanoparticles may offer several advantages due to their small size, but only the smallest nanoparticles penetrate the mucosal membrane by paracellular route and in a limited quantity because tight junctions are in the order of 3.9 to 8.4 angstrom. Controversial results are found when using nanoparticles in intranasal drug delivery. Now, intranasal microemulsions. Intranasal microemulsions are one of the focused delivery options for non-invasive drug delivery to systemic circulation. Now, talking about intranasal microspheres, microsphere technology has been widely applied in designing formulations for nasal drug delivery to provide prolonged contact with nasal mucosa. Microspheres are usually based on mucoadhesive polymers which present advantages for intranasal drug delivery. Microspheres swell in contact with nasal mucosa to form a gel and control the rate of clearance from nasal cavity. This increases the absorption and bioavailability by adhering to the nasal mucosa and increase the nasal residence time of drug. The ideal microsphere particle size requirement for nasal delivery should range from 10 to 50 micrometers. Furthermore, microspheres may also protect the drug from enzymatic metabolism and sustain drug release, prolonging its effect. Now we shall talk about aerosols for intranasal drug delivery. Drug delivery systems intended for deposition of medication into nasal passageways have long been used as a most effective means of administering drugs intended to produce either a local or systemic effect. Until recently, the modes of administering intranasal preparations have been limited to nasal drops, non-pressurized nasal sprays, inhalants, and intranasal gels, creams, and ointments. A new alternative to these traditional intranasal preparations is gaining rapid popularity, the pressurized metered nasal aerosol. Intranasal aerosol offers numerous advantages which are shown in the figure over the screen. As you can see in the figure, intranasal aerosol offers many advantages which include greater flexibility in product formulation, decreased mucosal irritability, great patient compliance, maintenance of sterility from dose to dose, lower dosage than comparable systemic preparations, minimal inadvertent penetration into the lungs, excellent depth of penetration into the nasal passageway, reduced droplets or particle size, and delivery of a measured dose of drug. In most cases, the intranasal formulation is almost identical to the comparable inhalation product. This is not surprising since the nasal passageways like respiratory airways require a fine uniform distribution of material to promote therapeutic activity and minimize irritability. Various attempts have been made to formulate these active ingredients in a non-aerosol squeeze bottle type of product. However, because of the relatively large particle size produced by the squeeze bottle, product has been found to be quite irritating to the nasal mucosa, with the particles being rapidly transferred to the back of the mouth where they are swallowed or expectorated. Probably the major difference between inhalation aerosol product and intranasal aerosol product is the design of the adapter. The nasal adapters are considerably shorter and narrower, minimizing propellant vaporization before contacting the mucosa. This results in a lower percentage of smaller particles, which is desirable because this decreases the number of particles entering the respiratory airways. Solution and emulsion types of nasal aerosols are also regarded as vehicles for delivery of medication through intranasal passageways but have proven to be intrinsically more complex to formulate. Forms of pressurized aerosol nasal preparations introduce additional problems like vehicle viscosity, irritation from additives, and leakage from nasal passageways. Now we will discuss the applications of intranasal drug delivery. It is shown in the figure over the screen. As can be seen in the figure, intranasal drug delivery has got a number of applications in like treatment of amnesia, treatment of angina pectoris and neurological deficit, treatment of epilepsy and schizophrenia, treatment of migraine, intranasal delivery of analgesics, intranasal delivery of vaccine, intranasal delivery of peptides. Lastly, we will discuss the nasal mucoadhesive drug delivery. It has been again shown in a figure over the screen for your consideration. Mucoadhesive nasal drug delivery involves a mucoadhesive carrier. When it interacts with the mucus, it leads to hydration and swelling of the hydrophilic polymer. Drug is released. The hydrophilic micromolecular drug is subjected to enzymatic metabolism, ciliary clearance, and internal absorption. So friends, today we discussed nasal drug delivery, its advantages and disadvantages, features of nasal cavity and mechanism of absorption. Further, we learned factors affecting nasal absorption and various nasal drug delivery systems. Thank you.